Hi, I am Dr. Filbert.
Hi, I'm Nurse Betty.
We're here today to speak to you about how nurses can use the relational lenses in the healthcare setting.
Relational lenses are used in coming to know the client and building relationships. They help you to view the client as an individual and to come up with the best possible plan of action for that particular client.
There are three types of relational lenses in which we will discuss. 1. The hermeneutic phenomenological lens, which is understanding a person's context. 2. The critical lens, which involves three perspectives: the feminist perspective, the post-colonial perspective, and the post-structural perspective, which deepen our understanding of the context. And 3. The spiritual lens, which deepens our understanding of both context and meaningful life experience.
We are about to perform a surgery on Mr. Clemens here. When we informed Mr. Clemens that he would require a surgery to remove his appendix, he was very reluctant. We realized he was somewhat scared to have the surgery because he had never had any type of surgery before. Using the phenomenological lens, we recognize that Mr. Clemens has his own individual free will and had the choice of whether or not he wanted to participate in the procedure. We did our best to educate Mr. Clemens on the possible outcomes of having the surgery and not having the surgery, but ultimately that the decision was his own.
With the use of the critical lenses, feminist perspective, we realized that Mr. Clemens did not want to participate in the surgery because he was somewhat scared. Mr. Clemens was reluctant to tell us of his fears because of the fact that society forbids men to be scared of anything. We reassured Mr. Clemens that his fears were quite normal, being that he has never undergone any type of surgery before and that many people, including men, experience these fears when it comes to surgery.
Using the post-colonial perspective of the critical lens, we also learned that Mr. Clemens was a residential school survivor, and that a part of the reason he did not want to participate in the surgery was because he felt as if he was not in control of his body. We realized that his negative experiences at residential school, where the approach of power over was constantly exerted on him, resulted in him not wanting to feel as if he was not in control of his own body. We did our best to reassure Mr. Clemens that any decisions he made were fully his own and that we would respect his choices.
Using the post-structural lens, we also realized that the use of language may create social reality. By using this lens, we were able to be intentional with the language we used and careful of our word choices as to not create any more fear or anxiety in Mr. Clemens. However, we realized the importance of being very open and honest about the risks of the procedure, and did not sugarcoat any information, so that Mr. Clemens was able to make a well-informed decision.
Using the spiritual lens, while talking with Mr. Clemens, we asked about his spiritual beliefs. We explained that being spiritual is not the same as being religious, as many people confuse the two concepts. Mr. Clemens explained that he was religious and that he had strong beliefs in God and the Catholic religion. Mr. Clemens said that he would continue to pray for strength and that God would take care of him whatever the outcome of the surgery may be. We realized that through the use of the spiritual lens, that Mr. Clemens' strong beliefs in God empowered him to make any decisions he did concerning the surgery.
Through the use of relational lenses, we were able to come to know our client, Mr. Clemens, and build a relationship with him. Thank you for listening to our understanding of relational lenses, and we hope that you now have a better understanding of the relational lenses and how you can apply them in practice.